It's really fascinating how things change in medicine, isn't it? Like, think about this. Before 1987, there was this specific heart condition. It was the second most common one found in cats.
Yeah, second most common. That's pretty high up there.
Right. So something must have shifted dramatically. What happened? That's the puzzle we're digging into today.
Exactly. We're doing a deep dive into feline dilated cardiomyopathy, or DCM for short, based on the info you shared with us.
Perfect. And this is really for you if you want to, grasp a medical condition quickly, get the essentials without drowning in technical terms.
That's the goal. We'll cover what DCM actually is, what causes it, how vets figure it out, and what can be done about it.
Right.
Really give you a solid overview.
Okay, let's do it. So first things first, what is dilated cardiomyopathy in cats?
Okay, so fundamentally, it's a disease affecting the heart muscle. The really critical part is something called systolic myocardial failure.
Systolic failure. Okay. What does that mean in simple terms?
It basically means the heart's main pumping chambers, the ventricles, they just can't squeeze strongly enough to push blood out effectively to the rest of the body. The pumping action is weak.
Got it. So the pump isn't working right. What does that failure actually do to the heart itself, like visually?
Well, because it's not pumping out blood efficiently, the blood kind of backs up and the heart starts to stretch and get bigger. It becomes dilated.
Ah, okay.
Yeah, picture like a balloon that's been blown up too much.
Yeah.
The walls get thinner and stretched out. And this leads to the heart being overloaded with blood volume.
Which sounds bad.
It is. It can ultimately cause congestive heart failure, where the heart just can't keep up with the body's demands, or it can lead to just low energy weakness because circulation is poor.
You mentioned 1987 being a key year. Why was that so significant for DCM?
Ah, yes. That's a really crucial part of this story. So before 1987, DCM was, well, much more common in cats.
Right. The second most common, you said.
Exactly. And for most of those cats, the underlying reason was a deficiency in their diet. They weren't getting enough of an essential amino acid called taurine.
Taurine. Okay, I recognize that from cat food labels, so that was the cause back then.
In the vast majority of cases, yes. We call that secondary DCM because the heart problem was secondary to the nutritional issue.
So what changed around 1987? Did we just figure this out?
Pretty much. The connection was made, and the pet food industry started routinely adding sufficient levels of taurine to commercial cat foods.
And that worked.
It had a massive impact. Really dramatic. Now, the type of DCM where we don't know the specific cause, what we call primary, or idiopathic DCM, that's actually pretty uncommon these days.
Wow. That's a huge aha moment, isn't it? Just changing the food formulation made such a difference.
It really was a major public health win for cats, essentially driven by nutrition science.
So if it's usually not taurine deficiency causing it now, what's actually going on inside the heart with this idiopathic DCM?
Okay, let's kind of zoom in. On a microscopic level, if you look at the heart muscle tissue itself, you see damage.
Like what kind of damage?
You see muscle cells dying off, that's called myocytolysis. You see fibrosis, which is scarring. The tiny fibers within the muscle cells can be fragmented, broken up, and you might see vacuoles, like little empty spaces, forming in the cells.
So the muscle tissue itself is degenerating.
That's a good way to put it. It's breaking down, losing its structure and its ability to function properly.
And what about the bigger picture, the whole heart?
Well, looking at a heart overall, the main thing you see is this generalized enlargement. It's called global eccentric enlargement, meaning pretty much all four chambers of the heart, the two upper atria and the two lower ventricles, get bigger, stretched out. The whole organ essentially balloons outwards.
And the walls get thinner, like you said before.
Yes, particularly the walls of the main pumping chambers, the ventricles. They become thin and weak.
Okay, so we have these changes, microscopic and macroscopic. How does that translate into how the heart functions, or rather dysfunctions?
Right. The function suffers significantly. You get this progressive systolic failure. We talked about the pumping gets weaker and weaker.
Less forceful beats?
Exactly. Contractility, the ability to squeeze, goes down. And also, the heart doesn't relax properly between beats. Either its compliance decreases, so it doesn't fill with blood as efficiently.
Okay.
And another thing we often see is a problem with the mitral valve. That's the valve between the left atrium and left ventricle. As the heart chambers enlarge, the ring that holds the valve stretches too.
So the valve doesn't close properly.
Precisely. It leads to what's called secondary mitral regurgitation. Blood leaks backwards through the valve when the ventricle tries to pump.
And vets can see all this?
Yes, these are the kinds of changes a veterinarian would look for on an echocardiogram, an ultrasound of the heart. It gives a very clear picture of the structure and function.
And the end result of all this dysfunction is...
Well, over time, this chronic poor function leads inevitably to congestive heart failure. And that's usually when the cats start showing obvious clinical signs that something is wrong.
So it's clear DCM hits the heart hard. But does it cause problems elsewhere in the body? Ripple effects?
Oh, absolutely. The cardiovascular system is primary, of course, but the consequences spread. One very serious one involves the musculoskeletal system, though it starts in the heart.
What's that?
It's called aortic thromboembolism. AEE for short. Basically, a blood clot can form, often in the poorly functioning left atrium.
Okay.
And then that clot can break loose, travel down the main artery, the aorta.
Oh, no.
Yeah, and it very often gets lodged where the aorta splits to supply the hind legs.
Blocking the blood flow.
Completely, or partially. It causes sudden, severe pain and paralysis of the hind legs, paraparesis, or sometimes just one leg monoparesis. It's a true emergency.
That sounds absolutely terrifying. What other systems can be affected?
Well, the kidneys can take a hit. When the heart's not pumping effectively, kidney perfusion, the blood flow through the kidneys goes down.
And that causes...
It can cause waste products like urea and creatinine to build up in the blood because the kidneys aren't filtering properly. We call that prerenal azotemia.
Okay. And breathing. You mentioned congestive heart failure.
Yes, the respiratory system is very commonly affected. Cats with DCM that progresses to congestive heart failure often develop rapid breathing, which is tachypnea, or labored difficult breathing, which is dyspnea.
Why does that happen?
It's usually due to fluid buildup. The failing heart causes pressure to back up into the blood vessels of the lungs, forcing fluid out into the lung tissue itself. That's pulmonary edema.
Fluid in the lungs, right.
Or fluid can accumulate in the space around the lungs in the chest cavity. That's called pleural effusion. Both make it very hard for the cat to breathe.
It's interesting. You drew a parallel with human DCM earlier. Now that taurine isn't the main culprit, do we think genetics plays a bigger role in cats like it does in people?
That's a really good question, and yes, the suspicion is strong. Given the genetic links in human DCM, it seems very likely that genetics are involved in feline idiopathic DCM too.
It either inherited or maybe a new mutation.
Exactly. Could be either. Now, we haven't pinpointed specific causative genes in cats yet, the way they have for some human forms.
But there's evidence.
There is suggestive evidence. There was one study I recall in a large cat breeding facility, and the findings did point towards an inherited component being likely. It suggests it's probably complex, maybe not just one gene.
Okay, so if idiopathic DCM is much less common now, how common is it? Do we have any numbers?
Well, uncommon is the word we use. That big dietary shift, thanks to taurine, really changed the landscape. There was a European study looking back at cases from 1994 to 2001.
Yeah.
They found DCM accounted for about 10% of all feline heart disease cases they diagnosed.
Okay, so still significant, but not like before 1987.
Right. And current thinking, sort of anecdotally and based on more recent observations, is that the prevalence might actually be even lower now than that 10% figure.
That's good news, relatively speaking.
It definitely highlights the success of that nutritional intervention. It's quite remarkable.
So we know it's this heart muscle issue, less common now, potentially genetic. Is there a typical patient profile? Like, who tends to get idiopathic DCM?
Well, obviously, the species is cats.
Hey, right. Got that one.
As for specific breeds, because it's less common overall, it's actually hard to identify strong breed predispositions from the data.
No clear patterns.
Not really clear ones. There is some suggestion, maybe, that Burmese cats could possibly be at a slightly higher risk, but it's not definitive.
Okay. What about age?
It tends to be diagnosed in middle age to older cats. The average age reported is often around 9 years old.
But there's a range.
Oh, yeah, definitely. The typical range cited is something like 5 to 13 years.
And male versus female, any difference?
You know, the studies on this have actually been a bit contradictory. Some suggest maybe male, some maybe female, some no difference. So the bottom line is there's no clear sex predisposition that we can definitively point to right now.
Okay, so middle-aged to older cats, maybe Burmese, but otherwise fairly widespread when it does occur. What signs should a cat owner be watching for? What might they notice first?
That's a tough one because, unfortunately, DCM can be quite insidious. Often, it's not diagnosed until the cat is already showing signs of congestive heart failure.
So it develops silently for a while?
It often seems to, yes. But there are things owners might pick up on if they're observant. Signs related to low cardiac output, the heart not pumping enough blood.
Like what?
Things like loss of appetite, just not eating well, maybe acting weak or lethargic, less active, maybe even seeming depressed.
Okay.
Then there are the signs more directly related to congestive heart failure, like the breathing issues we talked about, difficulty breathing, or just breathing much faster than usual, even at rest.
The dyspnea and tachypnea.
Exactly. And then, critically, there's that potential sign of thromboembolism, the blood clot.
The sudden hind leg paralysis.
Yes, certain onset of pain, dragging the back legs, maybe crying out. That's a huge red flag and needs immediate vet attention.
Absolutely. Okay, so those are things an owner might see. What about when the cat gets to the vet? What might the vet find on physical examination?
The vet will be looking for several clues. Interestingly, the heart rate can vary. It might be fast, slow, or even normal.
Okay.
Often they'll hear a heart murmur when listening with a stethoscope, typically a soft whooshing sound during the heartbeat, a systolic murmur.
Right.
They might feel that the heartbeat impulse through the chest wall is weak.
Yeah.
Sometimes they can hear an extra heart sound, like a little thud. This is called a gallop rhythm.
A gallop, like a horse?
Kind of, yeah. It's an abnormal third or fourth heart sound. And sometimes the rhythm itself might be irregular and arrhythmia. What else? Other potential findings could be hypothermia, a low body temperature, poor capillary refill time, meaning the gums take longer to turn pink again after pressing on them. The rapid breathing we mentioned. If there's fluid in the chest cavity, the lung sounds might be muffled or quiet. If there's fluid in the lungs, they might hear crackles. Sometimes there's fluid buildup in the abdomen too, called ascites.
Wow, lots of potential signs.
And of course, they'll check the pulses in the hind legs very carefully. They might be weak or absent if there's a clot, along with the potential paralysis, coldness, and pain in those limbs.
Okay, we've covered what it is, the effects, the signs. But the big question for idiopathic DCM remains, what actually causes it if it's not taurine?
And that really is the million-dollar question, isn't
Yeah.
it? The honest answer is, for idiopathic DCM, the precise underlying cause.
It's still unknown.
Frustrating.
It is. As we discussed, there's that strong suspicion of a genetic predisposition in certain cat families, or maybe certain breeds like the Burmese.
But no specific gene identified yet. Not yet in cats, no. So genetics is suspected, but the exact mechanism isn't worked out. And we always have to keep in the back of our minds that historical linked taurine deficiency was the major cause before food was routinely supplemented.
Right. So let's talk diagnosis. How does a vet nail down that it is idiopathic DCM?
It's a process, definitely. And a key part of it is ruling other things out, making a differential diagnosis.
What kind of things need ruling out?
Well, first, even though it's less common, you still have to consider taurine deficiency DCM, especially if the cat's diet history is uncertain or unusual. The approach is often to assume it could be taurine-related until proven otherwise, maybe by testing levels or seeing response to supplementation.
Okay, rule out taurine deficiency. What else?
You need to differentiate it from heart failure that might have developed from other different kinds of long-standing heart problems. Also, sometimes another common feline heart disease, hypertrophic cardiomyopathy, or HCM.
Where the heart muscles gets too thick.
Exactly. Sometimes, in its very late stages, an HCM heart can actually thin out and dilate, mimicking DCM. So you need to distinguish that end-stage or burned-out HCM.
Tricky.
Can be. And there's another rarer heart muscle disease called arrhythmogenic right ventricular cardiomyopathy, or ARVC, that needs to be considered too.
Okay, so ruling things out is step one. What about lab tests? Does blood work help?
Yes, lab tests are important pieces of the puzzle. Routine blood work, like a complete blood count, biochemistry profile, and urinalysis, might show changes related to organ perfusion from the heart failure, like those kidney value increases, the azotemia we mentioned. It's also standard practice to check thyroid hormone levels, usually a T4 test. You need to rule out hyperthyroidism, an overactive thyroid, because that can cause heart changes too, sometimes mimicking DCM.
Right. And can you test for taurine levels directly?
You can, yes. It involves sending samples, either plasma or whole blood, to specialized labs. If the levels come back very low, typically below 40 nanomoles per liter in plasma, or below 250 in whole blood, that strongly suggests taurine deficiency is the cause.
Okay.
And then there are cardiac biomarkers. These are substances released into the blood when the heart muscle is stretched or damaged. Things like NT-proBNP and cardiac troponin I, or CTNI.
And they be high in DCM?
Yes, they're usually significantly elevated if the cat is in congestive heart failure due to DCM. It helps confirm heart strain.
What about seeing the heart itself? Imaging.
Imaging is absolutely critical. Chest x-rays or radiographs are usually taken first.
What do they show?
They might show evidence of the fluid buildup, pleural effusion, or pulmonary edema, and they can often show cardiomegaly, meaning an enlarged heart silhouette.
But x-rays don't show the inside working.
Not the internal structure or function in detail, no. For that, the gold standard, the key diagnostic tool, is echocardiography, the heart ultrasound.
Right, you mentioned that earlier. What specifically are they looking for on the echo?
With the echo, the vet can see those characteristic changes of DCM in real time. They're looking for those thin ventricular walls, the enlarged chamber sizes, especially the left ventricle and left atrium, and, crucially, poor contractility. They measure how much the ventricle squeezes, something called fractional shortening, and at DCM, it's low.
So it directly shows the weak pumping.
Exactly. The echo can also often visualize the fluid around the heart or lungs if it's present, and sometimes can even detect blood clots within the heart chambers.
So echo is really definitive. Are there any other procedures sometimes used?
An electrocardiogram, the ECG, can provide useful information too. It records the heart's electrical activity.
What can that tell you?
Sometimes the ECG might be normal, but often it shows patterns suggestive of heart chamber enlargement, or it might detect arrhythmias, those irregular heartbeats.
Okay. And if there's fluid in the chest?
If there's significant pleural effusion, the vet might perform thoracocentesis, draining the fluid with a needle. Analyzing that fluid can be helpful.
How so?
It helps rule out other causes for the fluid, like infection or cancer. In heart failure, like that seen with DCM, the fluid typically has specific characteristics. It's usually what's called a modified transidate.
Got it. So putting it all together, history, exam, labs, and especially imaging leads to the diagnosis.
That's the process, yes.
Now, if we were to look at the heart after death, pathologically, what are the hallmark findings?
Pathologic findings confirm what we see on echo. There'd be an increased heart size relative to the cat's body size. All 4 heart chambers would typically be dilated, enlarged. The walls of the ventricles, particularly the left ventricle, would be noticeably thin, and the left ventricle's overall volume would be large.
What about the valves?
Interestingly, the heart valves themselves, the leaflets, are usually structurally normal in primary DCM. The leakage we see, the regurgitation, is due to the chamber stretching, not a primary valve defect.
And microscopically?
Microscopically, you'd see that evidence of muscle cell damage, the myocytolysis, the fibrosis, or scarring, confirming the muscle disease.
Okay. Let's shift to treatment. A cat is diagnosed with DCM. Maybe they're in heart failure. What's the approach?
Treatment often needs to start pretty intensively, especially if the cat presents in congestive heart failure, having trouble breathing. Hospitalization is usually required initially.
Intensive care, maybe?
Sometimes, yes.
Yeah.
Especially for the first 24, 48 hours, good nursing care is absolutely vital.
What does that involve?
Often, the most immediate need is thoracocentesis, draining that fluid from the chest to help them breathe easier. Oxygen therapy is also crucial.
Right.
If the cat is cold, hypothermic, providing gentle warmth is important, just supportive care to stabilize them.
And once they're more stable or for ongoing care?
Activity restriction is important, especially after they go home. Rest is key.
Makes sense. What about diet?
Well, initially, the big challenge can be just getting them to eat, as appetite is often poor. So offering palatable foods, maybe warming them slightly, might be needed. Long-term, a sodium-restricted diet is generally recommended to help manage fluid retention.
Okay. And educating the owner must be important too.
Hugely important. Owners need to understand this is likely a chronic condition, and things like repeat thoracocentesis might be necessary down the road. Monitoring at home is also key.
Let's talk medications. What are the mainstays for treating DCM?
There's a range of drugs we use. A cornerstone is usually furosemide.
That's a diuretic?
Yes, exactly. It helps the kidneys remove excess fluid from the body, reducing pulmonary edema and pleural effusion. It's crucial for managing congestive signs.
Okay. What else?
Pimobendan is another really important one. It's technically not licensed for cats in all regions, but studies have shown significant benefits.
What does pimobendan do?
It has 2 main actions. It helps the heart muscle contract more forcefully. It's an inodilator, and it also widens blood vessels, which reduces the workload on the heart.
And it helps?
Yes. Studies, including one key one, showed that cats with non-taurine-related CHF treated with pimobendan live significantly longer than those who weren't. It's become a very common part of therapy.
That's great progress.
It really is. Then there's taurine supplementation. Even if deficiency isn't proven, it's usually given initially to all cats diagnosed with DCM, just in case, until tests come back, or response is assessed.
Covering the bases.
Precisely. In very acute, severe heart failure, sometimes nitroglycerin ointment is applied to the skin to help quickly reduce fluid overload.
Okay.
For longer-term management, drugs called ACE inhibitors, like enalapril or benazepril, are often used. They also help reduce strain on the heart.
What about drugs to directly strengthen the heartbeat, besides pimobendan?
Well, historically, digoxin was used more often for that positive inotropic effect, strengthening contraction. It also has other effects.
Oh, but
It has potential side effects and a narrow safety margin. And with the advent and success of pimobendan, its use has declined somewhat, though it still has a role in some cases, maybe for controlling certain arrhythmias.
I see.
In really severe decompensated cases in the hospital, when oral meds aren't working or can't be given, an intravenous drug called dobutamine can be used for short-term support to boost heart function.
And what about the blood clot risk, that AEE?
Very important point. Antithrombotic agents are almost always recommended to try and prevent clot formation.
Yeah.
Clopidogrel is commonly used, sometimes aspirin or even injectable heparin initially in high-risk cases.
Right, prevention is key there. And arrhythmias. If the ECG shows an irregular heartbeat.
Yes, if significant arrhythmias are present, antiarrhythmic drugs might be needed. The choice depends on the type of arrhythmia. Options could include diltiazem, lidocaine, usually in emergencies, sotalol, or atolol.
Are beta blockers like atenolol used often?
They have to be used very cautiously. While they can help with certain arrhythmias or potentially slow disease progression in some heart conditions, beta blockers can initially worsen heart failure because they slow the heart rate and reduce contractility. So usually only started once the cat is stable, if at all.
It sounds like a complex balancing act with all these potential medications. Are there particular precautions?
Definitely. You have to be mindful of potential complications and interactions. For instance, using beta blockers or calcium channel blockers like diltiazem needs care as they can reduce cardiac output.
Okay.
Overdiuresis with furosemide or using ACE inhibitors or pimobendan too aggressively can sometimes lead to dehydration, low blood pressure, kidney problems, or electrolyte imbalances like low potassium.
Right. Monitoring is key.
Absolutely. Digoxin, as I mentioned, has toxicity risks, especially if kidney function is poor. And ACE inhibitors also need caution in cats with pre-existing kidney disease.
So what does the follow-up care typically involve? How often do these cats need to be seen?
Regular checkups are crucial. After starting treatment for heart failure, a recheck is usually scheduled fairly soon, maybe within a week or so.
What happens at that checkup?
They'll reassess the cat's clinical signs, check breathing rate and effort, measure blood pressure, maybe repeat chest x-rays, or a quick ultrasound scan to check fluid levels. Blood tests to monitor kidney values and electrolytes are also really important after starting diuretics and ACE inhibitors.
And ongoing.
Ongoing monitoring depends on the cat's stability. Owners are often taught how to monitor their cat's sleeping respiratory rate at home. That's a sensitive indicator of fluid buildup. Periodic vet exams, blood pressure checks, blood tests, and sometimes repeat echocardiograms are needed long-term.
You mentioned starting taurine initially. How long does it take to see if that's helping?
That's a good point. If taurine deficiency is the cause, you might see clinical improvement, better appetite, more energy, better breathing relatively quickly, maybe within weeks. But seeing improvement in the heart muscle itself on an echocardiogram can take longer, often several months.
Okay, that makes sense. Now, thinking about prevention, is there anything that can actually prevent idiopathic DCM?
For the idiopathic form, where the cause is unknown or genetic, there isn't a specific preventative measure, unfortunately.
Right.
But the most crucial preventative step we can take relates back to that historical cause.
Yeah.
Ensuring cats are fed a diet that's appropriate for them, high-quality protein, and critically guaranteed to contain adequate levels of taurine is paramount.
So, no vegetarian diets for cats?
Absolutely not. Cats are obligate carnivores. They must get nutrients like taurine from animal sources. Feeding inappropriate diets is the main preventable cause of the taurine deficiency form of DCM.
Understood. What are the main complications owners need to be aware of if their cat has DCM?
The biggest and most devastating one we've discussed is thromboembolism AEE, the blood clots. It's a constant worry with feline heart disease, including DCM.
That's sudden paralysis.
Yes. It's often painful, has a poor prognosis even with treatment, and can be emotionally very difficult for owners. Refractory congestive heart failure, meaning the fluid buildup becomes very difficult to control with medication, is another major complication.
So realistically, what's the expected course? What's the prognosis for a cat diagnosed with idiopathic DCM?
Sadly, despite all the treatments we have now, The overall prognosis for idiopathic feline DCM remains quite guarded to poor.
Especially if it's not the taurine responsive type.
Exactly. If there's no underlying taurine deficiency that can be corrected, survival times are often measured in weeks to months rather than years.
That's tough.
It is. Managing the congestive heart failure long-term is very challenging. As we mentioned, needing repeated thoracentesis to drain fluid becomes common for many cats as the disease progresses. The quality of life can decline significantly.
Okay. So just to wrap things up then, we've really unpacked feline dilated cardiomyopathy today. We looked at, what it is, that weakening and enlarging of the heart muscle.
Right, focusing on that systolic failure, the poor pumping.
We talked about the huge historical shift with taurine, how adding it to cat food dramatically reduced the prevalence.
A key takeaway, definitely. And how idiopathic DCM, the one with unknown cause, possibly genetic, is what we mostly see now, though thankfully less often.
We covered how it affects the whole body, the breathing problems, kidney issues, and that dreaded risk of blood clots.
And how diagnosis relies on clinical signs, ruling out other issues, lab tests, but especially that crucial echocardiogram.
And the treatment. It's complex, involving managing heart failure with diuretics like furosemide, drugs like pilobendin to help the heart pump, ACE inhibitors preventing clots, and potentially taurine supplementation.
A multifaceted approach, but often fighting an uphill battle against a progressive disease. The prognosis, as we said, generally remains serious.
It really highlights the advancements like pimobendin giving more time, but also the limits of what we can currently do for the idiopathic form.
Absolutely. And what strikes me reflecting on this is just how profound the impact of one single nutrient, taurine, turned out to be. It fundamentally changed the landscape of feline heart disease.
Yeah, it's incredible.
It really makes you wonder, doesn't it? Thinking about that. What other, maybe more subtle nutritional factors might be playing unexpected but significant roles in the health or diseases of our pets that we haven't fully uncovered yet?
That's a really interesting thought to leave people with. That connection between nutrition and complex diseases might be deeper than we often think.
Could be. Something to keep exploring.
Definitely. And for you listening, if you share your life with a cat, just being aware of potential signs of heart trouble like changes in breathing, appetite, or energy is so important. Hopefully this deep dive gives you a better understanding and helps you feel more prepared to talk with your vet if you ever have concerns.